In the contemporary field of oncology, a cancer diagnosis no longer equates to an insurmountable challenge. For 10 specific malignancies, advancements in early detection and therapeutic interventions have achieved survival rates exceeding 90%, provided the disease is detected at an early stage. These cancers, once considered daunting, are now among the most treatable, offering patients a renewed opportunity for health and longevity. In this video, we will look at the 10 curable cancers, exploring their epidemiology, risk factors, and treatment modalities. Armed with this knowledge, you can take proactive steps to safeguard your precious well-being. Number 1. Thyroid cancer. Thyroid cancer arises in the thyroid gland, a critical endocrine organ located in the neck. Characterized by its typically indolent progression and localized nature, it ranks among the most treatable malignancies when diagnosed early. Women aged 40 to 50 are disproportionately affected, 3 times more likely than men, often due to risk factors such as prior radiation exposure or inherited conditions like multiple endocrine neoplasia type 2, MEN 2. The cornerstone of treatment is thyroidectomy, the surgical removal of the gland, frequently augmented by radioactive iodine therapy to eradicate residual malignant cells. With a 5-year survival rate of 99% for localized cases, thyroid cancer exemplifies the efficacy of timely medical intervention. Number 2. Prostate cancer. Prostate cancer, originating in the prostate gland, is a prevalent malignancy among men, particularly those over 65. Its often slow-growing nature allows for detection through routine screening, such as the prostate-specific antigen (PSA) test. African American men and individuals with a familial history face elevated risks. Treatment strategies vary based on disease aggressiveness and include surgical removal of the prostate, radiation therapy, or active surveillance for low-risk cases. When identified at an early stage, the 5-year survival rate exceeds 99%, underscoring the indispensable value of regular screening in altering disease trajectories. Number 3. Testicular cancer. Testicular cancer, though uncommon overall, is the predominant cancer in men aged 15 to 35. Its high curability stems from its responsiveness to treatment, particularly when detected early. Key risk factors include cryptorchidism, undescended testicles, and a hereditary predisposition. The primary therapeutic approach is orchiectomy, surgical removal of the affected testicle, often sufficient for cure, with chemotherapy or radiation employed in more advanced presentations. The localized 5-year survival rate of 99% highlights the importance of self-examination and swift clinical evaluation. Number 4. Skin cancer. Melanoma. Melanoma, the most aggressive form of skin cancer, develops from melanocytes, the skin's pigment-producing cells. While it poses a significant threat if it metastasizes, early-stage melanoma is highly curable. Individuals with fair skin, excessive UV exposure, or a high number of atypical moles are at increased risk. Treatment typically entails surgical excision of the lesion, with adjuvant therapies such as immunotherapy or targeted drugs reserved for progressed cases. For localized melanoma, the 5-year survival rate surpasses 99%, emphasizing the critical role of routine skin surveillance. Number 5. Breast cancer. Breast cancer, the most frequently diagnosed cancer worldwide, predominantly affects women over 50. Its prognosis is markedly improved by early detection, often facilitated by mammography or breast self-examination. Risk factors include genetic mutations such as BRCA1 and 2, family history, and modifiable factors such as obesity or excessive alcohol use. Treatment is tailored to the tumor's characteristics and may involve lumpectomy, mastectomy, radiation, chemotherapy, or hormonal therapy. When detected early, the 5-year survival rate reaches 99%, reflecting the profound benefits of vigilant screening practices. Number 6. Uterine cancer. Uterine cancer, specifically endometrial cancer, is the most common malignancy of the female reproductive system. It frequently manifests with postmenopausal bleeding, a symptom that often prompts early investigation. Postmenopausal women are at greatest risk, particularly those with obesity, unopposed estrogen exposure, or genetic conditions such as Lynch syndrome. Hysterectomy, the surgical removal of the uterus, is the primary treatment, occasionally supplemented by radiation or chemotherapy. The 5-year survival rate for localized disease is 95%, reinforcing the importance of heeding early warning signs. Number 7. Hodgkin's lymphoma. Hodgkin's lymphoma, a malignancy of the lymphatic system, is notable for its exceptional responsiveness to therapy. It primarily affects young adults and individuals over 55, with a slight male predominance. Risk factors include prior infection with the Epstein-Barr virus, EBV, and immune suppression. Treatment typically combines chemotherapy and radiation, yielding a localized 5-year survival rate of 93%. Even in advanced stages, Hodgkin's lymphoma remains highly manageable, reflecting significant therapeutic advancements in hematologic oncology. Number 8. Kidney cancer. Kidney cancer, often detected incidentally during imaging for unrelated conditions, benefits from frequent early diagnosis. It predominantly affects men over 60 with smoking, obesity, and hypertension as established risk factors. Surgical intervention, either partial or radical nephrectomy, forms the backbone of treatment, with targeted therapies or immunotherapy utilized for metastatic disease. The 5-year survival rate for localized kidney cancer is 93%, demonstrating how opportunistic detection can lead to favorable outcomes. Number 9. Ovarian cancer. Ovarian cancer is challenging to diagnose early due to its subtle symptoms, such as bloating or pelvic discomfort. Yet, when identified at an initial stage, it is highly treatable. Women over 50, especially those with BRCA mutations or a family history, are at heightened risk. Treatment involves surgical resection of the ovaries and fallopian tubes, typically followed by chemotherapy. The 5-year survival rate for localized cases is 93%, highlighting the need for increased awareness and prompt evaluation of nonspecific symptoms. Number 10. Cervical cancer. Cervical cancer, once a major cause of mortality among women, has become both preventable and treatable due to widespread screening and vaccination programs. It most commonly affects women aged 35 to 44, with HPV infection as the primary etiologic factor. Regular Pap smears enable the detection of precancerous lesions, allowing for early intervention. Treatment options include surgical excision, radiation, and chemotherapy, with a localized 5-year survival rate of 91.8%. The decline in cervical cancer incidence stands as a testament to the efficacy of preventive strategies. These 10 curable cancers aren't just statistics. They signal a revolution in oncology. Early detection paired with cutting-edge treatments has redefined cancer from a dire prognosis to a condition that can often be overcome. We stand on the cusp of a transformative era in cancer management, doctors assert. Each advancement in awareness and intervention brings us closer to a reality where cancer's impact diminishes. The imperative is clear. Get screened regularly, understand your risk profile, and respond promptly to symptoms. In this endeavor, hope is not passive. It is an actionable commitment that paves the way for a healthier tomorrow. If you have any questions or comments, please don't hesitate to leave them below. If you found this video helpful, we'd appreciate it if you could like and subscribe. Thank you for watching.